This is 4071, positioning and anatomy. We are still in lesson 1, the brain and neck, and today we're going to talk about our 7th topic, which is imaging of the neck, and we'll conclude that with CT of the brain with and CTA of the brain with contrast. We still have more brain imaging techniques to discuss. They involve contrast, as does CT neck, but we're going to start with our study of contrast exams with the CT neck. Routine scanning of the neck is typically performed with the patient in the supine position and the neck slightly extended, with the arms down by the side. It's most often performed in helical mode, and to reduce artifacts that degrade the images of the lower neck, patients should be instructed to lower their shoulders as much as possible. And it may be necessary to increase KVP or MA to penetrate those lower shoulders. An AP and lateral scout are required to ensure that you have adequate coverage of the scan area. The anatomy included inferiorly should end at the aortic arch. This may or may not be common practice at different facilities. It is at mine, but you might run into that in different places. Both of our textbooks indicate that the scan should end at the clavicular heads or the apex of the lungs. Superiorly, the scan should begin about mid-orbit. Be sure to include all the skin from posterior to anterior. DeMaio talks about 2 separate scan segments to avoid streak artifacts from dental hardware. The first segment extends from the superior orbital rim to the hard palate, and the gantry is angled superiorly parallel to the hard palate. The second segment is acquired with the gantry angled parallel to the mandibular body. Make sure that those 2 groups overlap if you do this, and slightly, so that you'll ensure complete coverage of that posterior skull base in the neck. And this may not be possible with helical scanning, in which case follow that facility protocol. Now, unless contraindicated, IV contrast media is used in scanning the neck, the soft tissues of the neck. I forgot to mention this CTA, or CT of the neck, is also known as a soft tissue of the neck. So if you hear those terms, you'll hear them interchangeably. The goal in CT scanning of the soft tissue of the neck is to allow, or the goals are to allow sufficient time to, after the contrast administration, for the mucosa, the lymph nodes, and the pathologic tissue to enhance. Yet you want to also acquire the images while the vasculature remains opacified. There are strategies to allow the tech to achieve both of those goals in contrast administration. One strategy is a contrast injection technique referred to as a split bolus. The total contrast dose is split. It's often split in half, and the first dose is given at a delay of about 2 minutes, after a delay of about 2 minutes. And this allows the time for the structures structures that are slower to enhance or to be pacified. The delay is followed by a second bolus containing the remainder of the contrast, and scanning is initiated soon after the second injection is complete, using the second injection to more fully opacify the vessels. So what you have is a first injection of 50 milliliters, and then you scan after about 2 minutes, and then the second injection starts. You don't scan after 2 minutes. The first injection is 50 milliliters. There's a 2 minute delay. The second injection is 50 to 75 milliliters, and then you scan 25 seconds after the start of the second injection, so that you're getting the vessels opacified. Our facility only utilizes a 30 to a 35 second delay before scanning. It's going to be site dependent and radiologist protocol dependent. So what I want you to do is, this is another one of those, look at your facility, see what they're doing, and report back to me on that. So the indications for CT soft tissue neck include swollen and or inflamed lymph glands or nodes, infection, abscess, it's the most common one is the abscess, malignant neoplasms such as a carcinoma or sarcoma, benign masses such as cysts or lipomas, lymphadenopathy, trauma, endocrine glands like the thyroid or the parathyroid. A lot of times you're going to do this in children who can get an abscess in the back of their in the soft tissues of the neck like this. Pretty common. Window level and the window width for CT neck is going to be, it's going to include a soft tissue window of about a window width of 400 and a window level at 50. The bone windows are going to be a window width of 2,000 at a window level of 300. We typically don't turn in bone windows, but you may be at a facility that does. Learning the anatomy of the CT neck can be a little bit overwhelming. Looking at the image, you can see that most of the posterior region of the neck is muscle, but you have all these larger glands that are located laterally and below the mandible, and then you have vessels coursing in and out of them, and highlighted things everywhere, so it's kind of hard to, kind of overwhelming to see all of that anatomy and think that you can learn it, but it's not impossible. It just takes a little work. The larger vessels, such as the jugular vein and the carotid artery, located centrally, while the vertebral arteries are coursing through the vertebra of the vertebrae laterally. In this image, the trachea is displayed at the level of the hyoid bone, and the sternocleidomastoid muscles located laterally. You can see that. There are 2 pages in Romans that contain the soft tissue neck anatomy at a higher scan level than this image here on slide 60. So look at those images in Romans and study those to help you in that anatomy. All right, let's talk about a specialty scan, the scanning the larynx. The CT scans that specifically focus on the larynx are a specialty exam that I'm not sure you're going to see a lot of, but I would like you to keep track of the prevalence of these scans too, and let me know what you see. When scanning the larynx, the patient's positioned supine with the head extended to place the plane of the larynx perpendicular to the CT image, or on the CT image. In this position, the gantry is going to be adjusted so that the images are acquired parallel to the plane of the true vocal cords. One note to remember is to make sure to remove the head angle sponge from below the head cradle if it's there, so the patient's head's not elevated. You want the neck as straight as it can be, or as parallel as it can be. Thin section helical imaging of 0.5 to 2.0 millimeter sections are used, and the scan lines begin superior to the hyoid bone. They end inferiorly through the cricoid cartilage. So it's not a very long scan, but just enough to cover that anatomy. The images may be obtained during suspended respiration in an effort to improve visualization of the true vocal cords. Also, a phonation technique may be utilized to demonstrate abnormal mobility of the vocal cords. This technique involves instructing the patient to phonate a low, steady E sound during the entire scan. The window level settings for the CT larynx include a soft tissue window of window level of 50 and a window width of 400, and then what's called a wide window, just meaning that it has a wide range from a window level of a negative 300 to a window width of 1,000. The images in DiMaio depict 2 stages of scanning: quiet breathing and phonation with images are submitted in the soft tissue window and also in that wide window. You'll definitely need to utilize multiplanar reformats and the coronal and sagittal planes for this study. So indications for a CT larynx without ID contrast include masses and calculi. You can get vocal cord tumors and the stones and all that good stuff down there. When IV contrast is administered, indications include abnormalities associated with lymph nodes, tumors, including vocal cord lesions, vascular abnormalities, and inflammatory processes. One thing to keep in mind also is that the thyroid lens inherently has inherent iodine, and so it may be hyperdense after you get the patient contrast. So this slide 64 is just for your reference while you're studying the anatomy of the larynx. The image on the left is to be viewed as an axial slice through the vocal cords. So it's kind of, you're looking anterior and posterior. You are looking down through the vocal cords, that would be an axial slice. The image on the the image on the right is a sagittal view at about mid-sagittal plane. So as you compare the image on the left with the images in DeMaio, it's going to help you to kind of adjust your orientation to understand where that anatomy lies, so you'll know what to scan. So this concludes our study of the larynx. As I said, this is a CT exam. The larynx is not very common, but definitely is a helpful tool in identifying vocal cord abnormalities. So we're going to move right into CT